When it comes to connecting your world, what's your bottom line?
Controlling how, when, and where I watch my favorites.
Reliable connection to work at home.
Having options to fit my lifestyle.
High-speed internet so the fun never stops.
Streaming on multiple devices with no buffering.
At Eagle Communications, meeting your wants, your needs, your way is our bottom line. Eagle Communications, our community connected.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching, and thanks as always to the producer and editor of our series, Behind the Camera, Brandon Cooley. We're in the studios today with Dr. Lynn Fisher from Lifeline Family Medicine and the Rooks County Health Center as we talk to Dr. Fisher, who is a family medicine physician, about health care in rural America. Let's begin, if we could, Dr. Fisher, with how many years at Plainville or Rooks County Health Center?
Been in Plainville since January of 2006, so that makes it just a little over 12 years.
The Rooks County Health Center is somewhat different in configuration, I guess, from what we would sometimes think of as a normal hospital or in other areas of medicine. Tell us about the makeup of the hospital and your co-workers, if you would.
Right, so at our facility, we are not employed by Rooks County Health Center. We are all staff physicians there. I have several partners, Dr. Jen Brule, Dr. Dan Sanchez, Dr. Mike and Beth Aller. We all have our own separate practices that we run, but we work under the umbrella of post-rock family medicine. And so we have several different practices there, several different practice sites, kind of function as a group, but we are all independent and work independently at the hospital.
But many of those that you mentioned have been there a long tenure, such as you, Dr. Fisher.
Yes, Dr. Sanchez has been there, I think, around 25 years. Dr. Brule has been there probably close to 15 years, and our newest partners, Dr. Mike and Beth Aller, have been there at least 5, maybe 6 or 7 years. So there's been some longevity with the physicians that are at the facility.
With the overall umbrella at the Rooks County Health Center, what services are available, Dr. Fisher?
So all of us do family medicine, and so we do full scope family medicine. We take care of adults, we take care of kids, so we do some pediatrics. Some of us deliver babies, vaginal, and some of us also do operative obstetrics, so C-sections. Some of us are working in the emergency room at nights, covering the emergency room, taking call. And then some of us also do different procedures. Several of us do screening colonoscopies looking for colon cancer. A couple of our physicians do more women's health, so they may do colposcopies, which are taking biopsies of the cervix if there's abnormalities on a screening pap smear. Doing treadmill tests, so if somebody is having chest pain and we want to make sure that it's not cardiac disease, we do stress tests at the hospital. So we do, and we go to the nursing homes. We also take care of patients that are admitted to the hospital ourselves. So we do the full scope of family medicine at the hospital in Plainville.
It's really a complete umbrella, isn't it?
Yes.
What are some of the challenges that are faced at Rooks County Health Center for care at a community hospital, Dr. Fisher?
Yeah, I think it's, what many critical access hospitals face in rural areas is access to specialists. So, it's usually a family medicine doctor that is in the community providing care on a daily basis, but if you need specialist care, that can be a little bit of a challenge. Hayes is one of our referral sources, and they have quite a few different specialties, but not everything that you might need. And so, if you need a rheumatology consult, or if you need ear, nose, and throat, those services are not readily available in the area, and so patients have to travel a little bit farther to get those types of resources.
The overall care, though, can be done not only in the hospital at the Rooks County Health Center, but you also have outreach to nursing homes, and you have people that walk in, I assume, as well, plus the emergency care.
Yes. In Plainville, we also have a walk-in clinic that's situated within the hospital building itself, so no appointment necessary. People can just walk in, and the nice thing is on site we also have access to our radiology services, so if you need x-rays, if you need labs, if a CAT scan is needed, it can be done all right there, get the results back, discuss it with the patient.
Dr. Fisher, there has been some talk about expansion of CanCare that would probably expand coverage to some 150,000 Kansans. Would that be something that the Rooks County Health Center and you as a physician would like to see the state do?
Absolutely. Currently I'm the board chair for the Kansas Academy of Family Physicians, and our academy has taken a strong stance as well in supporting this effort. Giving coverage to our coworkers, our family members, our friends who would benefit from this coverage, is not only the financial help that comes to an individual practice or to our critical access hospitals by having people who are covered and they're reimbursed better than having to do as much charity care, but it's just also I think for me personally the right thing to do morally. I'm able to provide the services that somebody needs. Instead now somebody may not be getting the recommended cancer screenings that they need, or they can't afford maybe lab work that I would like to do to investigate their health problem more, or somebody that needs imaging tests but can't afford the cost of an MRI or a CAT scan. There are definitely deficits in care that I see because somebody doesn't have health insurance. And so, expanding those services, expanding coverage to people, is not only a benefit to private practices, the critical access hospitals, just the medical community in general, but also, that way people can get the care that they need and deserve.
And it is preventative care, which may in the long run be a savings because you can address some problems that you might be able to find earlier.
Exactly. If somebody undergoes a mammogram and finds a breast cancer early in the process, the total cost of care, if somebody maybe doesn't need to go extensive radiation or extensive chemotherapy, the cost is so much less. Or somebody finds a colon cancer early and you can just resect the colon and not have to undergo chemotherapy, additional testing. Or if I can give somebody a simple vaccine that maybe prevents them from being hospitalized for pneumonia. A hospitalization for pneumonia costs tens of thousands of dollars. The vaccine costs a couple $100. So definitely.
Who were your influences to get into medicine, Dr. Fisher?
I grew up in Ellis, and we had a part-time doctor there. It really ended up happening because of some experiences when I was in high school with some grandparents that were ill and in the hospital. Had a best friend whose dad died of lung cancer, and so got me thinking about a healthcare field. But I initially started off thinking about pharmacy. I liked sciences and had some exposure to somebody that worked in the pharmacy system and thought maybe I would choose that. So I started off on a pre-pharmacy path, and then when I was in college working in the pharmacy, even though it was kind of a limited exposure to what pharmacy did, working in retail pharmacy, I just decided that probably wasn't the best fit for me, and then decided that I would go into medicine. I had a really good friend from high school that was also going into pre-med, and just talking with her, I just felt like that was my calling, and so that's the path I pursued then.
She was at Ellis High School as well?
She was also at Ellis High School.
Where was the college training?
So I started off at Fort Hays for my first 2 years because, again, the plan was I was going to go to pharmacy school and then transfer to KU. And so when I made that change of heart on my major, I also then decided I would still transfer to KU. So I finished my undergrad degree at KU, and then from there went to KU Medical School for 4 years. I split my time between a couple of years in Kansas City, a couple of years in Wichita. Wichita was more for the training for the clinical rotations. And then after that, I did 3 years of residency in Greeley, Colorado, North Colorado Family Medicine. It was a community-based program, so only family medicine residents there, so you got exposure to everything. You didn't have to compete with other residents maybe that were in pediatrics or OB or surgery, so you got a lot of hands-on training, and then from there I came back to Kansas.
What about this medical career as opposed to the music career? Now, what happened there? I mean, we're talking about a Billboard chart topper here who's a doctor. What's going on with that, Dr. Fisher?
I had to be reasonable about things, right? No, I
More
love music.
practical, right?
Yeah, I love music. You know, my mom, you know, exposed us to music very early on, and so I have a great appreciation for it, and I am willing to share my talents, but I knew that probably was not a career path for me, and so, yeah.
Certainly not as perhaps as long-lasting a career path, maybe.
Right.
But a whole family of musicians, really, in the Fisher family.
Yes, yeah. Yeah, my mom and brother and I do some singing together, and even my younger brother, we all played band instruments. And
high school band,
yes,
anything?
yeah.
Did you have a group that performed in the area? Was it mainly high school orchestra band?
Right, high school band, yeah. Yeah.
What about this possibility of Crossroads again, that famous group of vocalists and instrumentalists who come together and have provided us so much music throughout this entire western part of the state, well, even statewide, I think we could say. Some great memories there.
Definitely. You know, actually, Crossroads started when I started med school. So that's how I can always remember, because I started medical school in 1997. So I always could remember that Crossroads was, you know, 20 years. And it was a great music ministry, did it for a long time, just kind of needed a change of things. And I know that there are some people who are still kind of meeting and singing. It won't be Crossroads, but who knows, there may be a resurrection of another group that does some music ministry in the community still.
They haven't completely disbanded then,
Not
as far as some
completely,
of the members.
yeah, not completely.
Interesting insights to the Rooks County Health Center and the possibilities of medicine, and our thanks for sharing that. Family medicine physician, Dr. Lynn Fisher, our community connection.
It's time to explore the great indoors.
Pirates ahead, all hands on deck and ready the cannons.
Where imagination has no boundaries.
And then the princess rode the dragon.
And fun is limitless.
Captain, we're ready for liftoff.
Explore the great indoors with Eagle Communications, with TV and internet starting at $84.99 for 2 years.
Eagle Communications is your ultimate business partner. We provide business class phone with customizable features and fast, reliable internet. Your knowledgeable team at Technology Solutions has a broad base of IT services to meet your needs. Let the experts at Marketing Solutions get your message to the right people on the best platforms. The only piece missing is your business. Call Eagle Communications today at 877-61-EAGLE.
Welcome to our Community Connection from Eagle Community Television. Thanks for watching, and thanks as always to the producer and editor of our series, behind the camera, Brandon Cooley. We're with Darin Myers, who is Fire and Emergency Management Director for Ellis County. Let's talk, if we could, Darin, about the department itself, your employees. What's the makeup of the department? A little background here.
So the Ellis County Fire Department's comprised of about 6 different rural fire departments stationed between Ellis, Hayes, Victoria, Munger, Catherine, and Shinshin. So they're somewhat strategically located around the populated areas of the county. Currently, we're right around 90 volunteers between all of the 6 companies, so it's a good number of volunteers. We're always looking for more, especially to help with our daytime response. But yeah, they're strategically placed in those areas throughout the county, so that way the people that are in those locations can respond to the stations to respond to emergencies as needed. And other than that, that's pretty much how we're comprised.
I was going to say, a good chance for you to do a little recruiting here,
Yeah,
Darin.
yeah.
So get
Always-
those
always looking
volunteers
for it.
interested here.
Yeah, we're really looking for some help over in Ellis and Victoria, especially during the daytime hours. Most of those outstations, besides the one here in Hayes, they travel to Hayes for their jobs. So if anybody knows of anybody, we'd definitely be interested in that.
What kind of background, what kind of commitment would be necessary to become a volunteer, Darin?
So each company is a little different. Obviously, the smaller stations don't run as many calls as some of the others do. Ellis, Hayes, and Victoria are the most busy because they're the largest towns here in Ellis County. But each of those 3 stations train twice a month for a couple hours on either Monday or Wednesday nights, depending on the company. And then, so that's kind of your set schedule for the next 20 years, however long you want to stay on. Other than that, when we ever have an emergency call for service, we carry the pagers. We have activation on our cell phones that we have to alert us for an emergency. So being able to get away from work or take time away from your family, unfortunately, that's pretty much the commitment level.
But as far as training a couple of times a month then for a couple of hours.
Yeah, and we strongly promote and encourage sending our firefighters outside the county to different fire schools, training, seminars, conferences, as much as they can afford to leave their family and their jobs to be able to go through that. We support and encourage that type of training because that way we can take the outside world, outside training, and bring that back to Ellis County. We can bring that within and share it with our other firefighters.
Darin and the crew have been actively involved, of course, in some rural fires, as you're well aware here during this past season. And there's going to be more with Darin on that with the forum with Eagle's Gary Shorman later on Eagle Community Television. So, Darin, we wanted to focus a little bit on tornado season with you. Give us a general time span for tornado season in Kansas. What are we looking at?
So usually it's about this time of year when it starts up. The last several years we've had tornadoes all the way starting in February. I don't think we've had any this year, but last week was Severe Weather Awareness Week, so we're already starting to promote that across the state with the Kansas Department of Emergency Management. But the last couple years, 5, 6, 7 years, the average tornado season for the state of Kansas is roughly just over 220 days, so almost 2/3 of the entire year. Range. We've had tornadoes in every month of the year.
Wow.
So I believe 2 years ago, maybe in 2016, the last tornado we actually had was on Christmas Day.
Oh my goodness.
In the state of Kansas, not here in Ellis County.
Yeah.
So it's we're prone to have tornadoes every month of the year. It's not necessarily just through those common months. However, those most common months that we do have tornadoes across the state are in May, April, May, and June. Mostly in May that we have the most tornado outbreaks.
Do you have any kind of off the head statistics about the number of tornadoes in Ellis County specifically?
So since they started recording the data here in Ellis or across the state, a good dates all the way back to about 1950. And since 1950, the recording, identification, and tracking of storms has gotten better. So the most accurate number since 1950 is that Ellis County has had 62 reported and confirmed tornadoes by the National Weather Service.
Ooh.
So that's roughly about one a year. However, the tornadoes, the frequency, the size, they have been progressively becoming more common. Over the last 6 years, we've averaged 2 tornadoes per year just here in Ellis County. I believe in 2016 or 14, Ellis County actually had the most tornadoes in 1 year per county for that county.
Wow.
So I believe that year we had 4.
Has there been an increase in severity generally, or is that tough to measure?
It kind of goes. They do have statistics on that, on the reported tornadoes. You know, throughout the state. I didn't look at anything up for that specifically, but I would say it probably would vary depending on year on the severity and the location of the tornadoes.
One of the public warning systems, Darin, of course, is the Sirens. How are we doing on the siren situation in the county?
So all of our sirens throughout Ellis County, between who owns them, between the cities of Ellis, Victoria, Hayes, Fort Hayes, and Ellis County, we all own separate tornado sirens. They're activated differently. They're different styles, different brands. However, they're all activated at one central point through our dispatch center, except for the city of Victoria. They range from dating all the way back into the mid to late 70s when they were installed, up to a couple years ago. The city of Hayes and Fort Hayes updated their sirens with a new siren. We are currently looking and did a survey just in December and January with a company called the American Signal Corporation. They came down from Wisconsin actually and spent about a day with us, a day and a half, going around looking at all the sirens that we have, their location, their placement, their size, to the type of pole they're on, how high the pole is, and how they're strategically placed in each location. And we're looking to upgrade those sirens maybe later this year cooperatively between all those agencies I mentioned earlier to become to develop a new outdoor warning siren system, not just individual sirens, but a system. As a common misperception about outdoor warning sirens is the community believe that they're supposed to notify them while they're inside a structure. And those sirens are not designed to do that. They're designed to notify when you're outdoors. So the new systems that they have incorporate different things to be able to notify the public more, not just from the sirens that are on the poles, but we can link those with indoor warning devices that can be tied into fire alarm systems. So the schools, nursing homes, the hospital, they would be able to buy individual systems that are linked to our tornado sirens. So if the hospital or the school districts here in Hayes, for example, would implement that technology, whenever we would sound the sirens for the city, the sirens in those local businesses would also be notified. So that way they could have as much time in preparation to take safety measures within those businesses or facilities, as much time as possible to do so.
Also, if you would, Darin, talk a little about an event that's coming up March 26th that's sponsored by the National Weather Service that you're going to be involved in and the public can be involved in.
Yeah, so on March 26th at both 3 and 7 p.m., the National Weather Service out of Dodge City will be in town. And they're going to do our annual storm identification training that the public and all of our emergency responders attend. I think last year we had about 100 people in attendance for the evening session, but I invite the public to come to find out more about severe weather, what to look for, what to be aware of, the different type of storm cells, how they progress, what's the difference between a scud cloud, a funnel cloud, and a tornado. So that way we have proper recording and reporting to us. But they'll be here. It's about a 2-hour class. You can pick one or the other at 3 or 7 p.m. and come to our station there at 1105 East 22nd here in Hayes and attend the training. It's very informative.
You're still using spotters too, aren't you?
Correct. Yep. So we have multiple levels of that throughout the county. The city of Hayes, between the Hayes Fire and the Hayes Police Department, they have predetermined positions that they certain trigger points will put them at. They'll go out and start monitoring the weather, as well as it's a little bit different for us in the county. We use the county fire department and the sheriff's department, and we more or less kind of surround the storm as it comes within the county, and then we progressively either stay above it or below it or in front or behind it, I guess, as it moves through the county, so that way we have as much notice as possible. Most of the time the storms come out of the southwest part of the county and progress to the northeast when we're looking at tornadic events. However, that's also a, not really a myth, but the majority of the time that's the way they move. However, that's not always the case. They can track in different locations in different directions. So,
tell me about the county alert system, if you would, too.
So when we have severe weather, We put it on our social media. Get on the Ellis County Fire and Management Emergency, or the Facebook social media site. And we have blurbs on there to be able to get to the link, but it's called Civic Ready. And there's a link on our website as well as on the county website to be able to go to that. Once you do that, you can sign in with your phone number and your address, and you can get emergency notifications either from the National Weather Service, which you can select which ones you want to be alerted of, a tornado warning or watch, or maybe even a tornado emergency, flood warnings, winter storm warnings, all that. And they'll be sent directly to the device that you want selected. As well as we've taken all of our 911 data and we've exported it out of our dispatch center and inputted it into this system, so that way we can select an area on a map and call all those people, all those landlines within that location to say such and such event was going on. If it's a geographically located, I can say this is the area, and it can make those phone calls and emergency alerts. It's free to the public. There's no charge to do it, but the biggest thing is the public has to take the initiative to actually get onto the website and sign up for it.
And that website, once again, is?
You can go to the Ellis County, which is www.ellisco.net, and it's on the bottom right-hand corner. It'll say Civic Ready.
Darin, in the final couple of minutes here, I know that there have been some people who have worked with you in these rural fires and other emergency areas. Give you a chance to recognize those folks.
Yeah. So last week we were pretty busy. We had the two different fires that got a lot of attention here, just right outside of Hayes, along I-70, and all the way up at the Toulon and Homestead area. One fire was about 100 acres in size, and the other one was about 5,100 acres. It was very taxing for everybody that was involved. A couple things for the community, the public to keep in mind is we need to let our emergency responders work up there. If you see a fire up there, please stay away. Don't go up there and look at the fire. Just because you can see the fire, you need to stay away as far as you can.
You don't want any observers, basically.
Yes, we have a lot of traffic. We're not always on the fire line working that fire. We're getting back on the roads. We're getting crews relieved. We're getting them out, getting them more water, making repairs. And we had a lot of onlookers up there that
got in the way,
slow us down.
Yeah.
We actually had one highway patrol trooper involved in an accident up there. So. Luckily they're okay, but that could have been prevented if everybody would just stay away. But yeah, from the Highway Patrol to the Ellis County Sheriff's Department, Ellis County EMS, all of our county firefighters, the National Guard, Kansas Department of Emergency Management, Hayes Police Department, Ellis County Public Works. We were all out there for about 14 hours heavy on March 6th. And they all did a great job. The firefighters did an excellent job protecting the structures, protecting people's homes. The law enforcement was out in front of us, in front of that fire line, letting us know where the homes were, getting people evacuated as necessary. Everybody came together and did a great job. We're lucky. We're a great community here in Ellis County. All the support that we got afterwards during the fires, hundreds of cases of water, Gatorade, snack foods for them to be able to come up and just give them a little bit of energy to keep going. All the businesses that came out, all the local farmers that came out, helped plowing roads, bringing us water. A fire that size, 5,100 acres, the fire was about 20 miles around the perimeter. We never ran out of water, and that's just amazing on how many people came out to supply water. We will be looking at here in the future, I'm going to try to get a date set up so that way we can invite a lot of our community members that were involved with that fire, or a lot of the businesses that brought water up there and supplies. We'd like to communicate with everybody and bring them in and discuss, how maybe we can do better with the communication between our emergency responders and them, So that way, if they do lend assistance, we can help coordinate a little bit better. And I value everybody's input, and I value theirs as well. So if they can come in, and we'll get a date set here in the future and invite everybody in for a short little meeting and try to make it better, because this will happen again. You know, the last year, almost to the day, one day off, is the big Codell fire that we had up there. It was 7,300 acres last year, so it's not looking any better. We're not getting any precipitation.
With all those people you named, Darin, we want to say as well, for the folks in the county, thank you very much for your efforts and your work on behalf of our safety. Darin Myers, Fire and Emergency Management Director, and our Community Connection. I'd like to close today with a thank you to the producer of Community Connection, Brandon Cooley. Brandon's leaving for new adventures as Marketing Director of the Hays Convention and Visitors Bureau. It's said that real work takes place behind the camera. Well, that's certainly true in the case here. In addition to coordinating the camera work, Brandon also edits, titles, and schedules Community Connection for us. And all, I might add, in a professional and dedicated manner. Community Connection is going to be taking a leave of absence for a while, so Eagle Management can determine future plans for the program. And I'd like to thank those who have shared their interests and their expertise with us. And also thank you for watching Community Connection.
Hi, I'm Gary Shorman, President and CEO of Eagle Communications, a 100% employee-owned company. I'd like to personally thank you for selecting Eagle for your internet, television, and telephone service. By choosing Eagle, you're choosing to keep your dollars local with a company that reinvests back in your community. Let's make this a great year for your community. Check us out at eaglecom.net. Eagle Communications, our community connected.